Wellness webinar with our CDHNOP conversation. Listen, you guys, by now you should know that the Caribbean Diaspora Healthy Nutrition Outreach Project is 100% committed to the health and well-being of the Caribbean diaspora and of course our South Florida community in general. So if you haven't already done so, this is my invitation to you. Grab a healthy lunch, grab a bottle of water, and make this a healthy lunch and learn conversation. My name is Commissioner Melissa P. Dunn. I am going to be the host of this conversation today. And we have a special guest that I know is no stranger to the South Florida Caribbean community. He is Mayor Wayne Messam. Now, Mayor Messam lives in Miramar, and he's done so for over 21 years. He is a first generation American. Wayne was the first of his parents' children to be born in the United States. He was raised in South Bay, Florida by a loving, hardworking Jamaican parents. His father, Mr. Herbert Messam, labored in the sugar fields in the Glades as a migrant contract worker for nearly 2 decades after immigrating to the United States with his family. Mayor Messam has always had a commitment to public service. He was elected to the City of Miramar's commission in March of 2021. The city also boasts more Fortune 500 companies than any other city in South Florida. I'm gonna have to learn your secret for that one, Mayor Messam. And he has a very thriving aviation, biomedical, information technology, and light manufacturing business sector in Miramar. Mr. Mayor, welcome.
Nice to see you, Commissioner. How are you today?
I am well, thank you. So your dad was from Jamaica?
Yes, both parents are from Jamaica, from Manchester. Yeah, I was the
Oh,
first of my parents' children born in the United States. My older brother and 2 older sisters were born in Manchester.
oh, very nice. That's so special. So all of my siblings were born in Jamaica.
Okay.
And my youngest brother, Kareem, is the first of our generation to be born in the United States. So that's no pressure on you at all, right? Well, you've certainly delivered in the success category. I see your Florida State poster on the wall there.
Oh yes, I'm a diehard Florida State University fan. In fact, I'm a former football national champion with Florida State. I was at Florida State on football and academic scholarship, and the picture right above my shoulder here on my shoulder right there is my first touchdown I caught as a freshman. So it's
Wow.
something I use to keep as a keepsake and to remind me of my college days.
Oh, fantastic. I really do believe that you really learn how to be a leader as a student athlete, I think.
Oh yeah, I had a great experience at Florida State. I not only was on the football team as well as I ran track for 2 years as well, but I was very active on campus. I pledged Alpha Phi Alpha fraternity my sophomore year. I was former student government vice president. So I've had a very active student life as well as on the field. So I can say that going to Florida State was a great opportunity and exposure for me. And also on our campus, we had a very strong Caribbean Student Association. So we had an opportunity to, stay connected, with the culture while being at Florida State.
Oh, I love it. So after you left college, what private sector work did you go into before deciding to run for mayor?
Well, after I left Florida State University, I had a brief stint in the National Football League with the Cincinnati Bengals. Once it was very short, I was only in the league for a year, but voluntarily decided not to pursue that career path. And I graduated with a degree in management information systems, which is an IT degree, and worked for companies like America Online, if you remember America Online for back in the day,
Yes.
WorldCom, and then when I transitioned back to South Florida, I was in the pharmaceutical industry for about 10 years. But during that time, I was investing in real estate, which birthed what I'm doing right now. I'm a Florida certified general contractor. I do commercial construction, many governmental institutions, school. We're in the education sector, healthcare sector, and we pride ourselves in providing opportunities for other minority and women-owned and small business companies. So Messam Construction, we're one of the fastest growing minority contractors in the state, and we've been very fortunate and blessed. And that's what pays my bills outside of serving the residents of the city of Miramar.
Oh, that's fantastic. I knew about the construction. I did not know about the pharmaceutical. So what made you decide to run for office?
Well, when as a young family here in Miramar, having young children, just wanting to be involved in the community as well as we started our company back in 2003, and I started volunteering on various boards. I was a former chair of Broward County Small Business Development Advisory Board to Broward County before even becoming an elected official. And then decided to volunteer in our city. And one thing just kind of led to another. It wasn't like a master plan to be an elected official. I was just earnestly just serving and volunteering on advisory boards, and folks kind of urged me I probably should consider to run. In fact, when I ran for commission back in 2011, it was really a last minute decision. I literally decided to run a few weeks before filing. So I didn't like amass a lot of campaign money or even grassroots efforts to run. And God will would have it that I actually won my election with just about a month and a half of campaigning, and it turned
Wow.
from there. So, but after my first 4-year term as commissioner, I decided to challenge my predecessor, who had been in office for 20 years. And when I was elected in the city of Miramar in 2015, I became the first Black mayor of the city of Miramar. I guess the first Black Caribbean American or Jamaican American. Many boxes that I check, and I don't take that lightly. And I bring all of these experiences with me to this office, and I'm just so glad to be talking about health and wellness because it's a very important topic for me.
Yeah, for sure. And it's interesting because in Miramar, you guys are a melting pot. I believe that you guys are the fifth largest Caribbean diaspora in the US. Is that true?
Well, definitely the fifth largest Jamaican diaspora, and we have other Caribbean diasporas here. We have a very large Haitian community, and growing Latin community as well. In fact, Hispanics make up about 30% of our community.
Oh,
Um,
wow.
and African Americans, and I would say English speaking or Black and French speaking residents make up about nearly 60% of the population, and the balance is Caucasian. So the city of Miramar, we're very, very diverse. It's not what some would say, for example, let's say a Black city per se, but we have a very large, diverse Black and Brown community. Our numbers may end up being around 150,000 once we assess the final tallies from the census. So we're the 13th largest city in the state now.
Wow, that's amazing. What kind of programs and resources do you have that kind of infuse and celebrate that cultural diversity?
Well, the city of Miramar, we have a lot of cultural events. If you pay attention to some of the events the city puts on and activities from my office, I try my best to be as inclusive as possible. When I do recognize different community segments, I go real hard on them in terms of promoting, whether it's a Jamaican event or Haitian event or Colombian event. I want all of our community to come out to learn more about a different culture that you may not
Yes.
necessarily be familiar with. So we had a great, for example, on 4th of July, we had a concert and fireworks display at our amphitheater at Regional Park. But our entertainment was we had Taylor Dane, pop artist. We
I
had
know, I love her. Yes.
Timba Live, who was a Cuban band, and then we had Morgan Heritage to headline the
Stop.
event.
I love them. How did I not know about that?
Yeah,
They're like
so
one of my favorites.
it's so we made sure to do something to incorporate everyone in our community. So that the goal is that no matter where you're from, what your background is, you feel that the city of Miramar is your city because there's something for you to do and benefit from in our community.
I love that. Well, Mayor Messam, I know that you have been very active in terms of promoting health and wellness. The research that's been done by the CDHNOP group really says that the Caribbean community has a significant, like a higher prevalence of diabetes, high blood pressure, and stroke. And of course, that's all impacted by obesity. What are you doing to kind of help in the health arena in your city?
Well, being very healthy and a healthy mindset is natural for me. Growing up being an athlete all my life,
Hmm.
it's something that I've always just has become a way of life and a matter of lifestyle for me. So I bring that to the city. I make sure that we are engaged in terms of health and providing those opportunities. Some of my marquee events is my annual 5K and health and fitness fair. It's an event that's held in the first weekend of March, where we have a 5K where we bring in the community, and after the 5K, we have a fitness fair where we have cooking demonstrations. We have South Florida's largest salad bowl. We bring in celebrity chefs to show our community on how to cook their favorite cuisines in a healthy way. We do
Love
health
that.
screenings with Memorial Health Systems to check bone density, blood pressure, glucose levels. But we provide resources to let folks know that, hey, here are some options. You don't have to give up your culture. You don't have to give up your way of life. Here are some alternative ways, some alternative seasonings, natural herbs, less processed foods. And we bring in the local fitness gyms and clubs to give demonstrations and give away free memberships for trials so that folks can see, what options are out there. But the most important thing is that to get a group. And one of the things I do, I started a Mayor Messam's Run Club, and we run 3 days out of the week.
Oh,
Mondays,
yeah, I
Wednesdays,
saw that.
5 a.m. and on Saturdays at 6. And what it does is it just brings the community together. People from all walks of life, regardless of their fitness level, can come out in a safe environment and and set goals and meet other neighbors, and that's what it's all about.
Oh, that's awesome. That's like one of your collaboration with Black Men Run, right?
So it's a the Run Club is through my office. Me personally I happen to be involved with Black Men Run to promote the running lifestyle
Oh,
for Black
gotcha.
men. So yeah, so I do often share a lot of my experiences from the Run Club to Black Men Run. There's a South Florida chapter.
Oh, I love that. So that's how I knew about your running, because I've seen your posts. And I think back when I was trying to run, I saw you at the finish line at some of these races. You are really a serious runner. And I have to say that I admire that greatly. So, Mayor Messam, I know that your schedule is super busy. Like, how do you stay healthy and active? I know you run, but what else do you do? I know you're leading by example down there.
Yeah, like I said, it's a lifestyle. I make sure that I incorporate fitness in my way of life. My morning solitude is usually in the mornings when I run. That's my opportunity for me to clear my head while also, building and protecting my body. It's the place where I
Mhm.
am myself and my mind and my thoughts, can be, with me. So and that's a great way to stay healthy. I try to cook at least 2 or 3 times a week. And so when I cook, I try to, I've eliminated many things out of my diet. For example, I don't eat pork. On occasion, I may eat a steak, but I primarily eat fish and vegetables, some chicken, but I'm not one of those persons say eliminate meat and all those types of things.
Yeah.
I'm not a tree hugger or anything like that. I just say it's all about moderation and
For
try not
sure.
to fry food and watch the sodium and salt intake and there's so many diets out there, so many options, but the most important thing is to value yourself, value
Yes.
your own vessel, know that your body will respond to what and how you treat it. And if you see yourself as your most precious commodity to the point that you're conscious in what you ingest, you're conscious in what you breathe, the air you breathe, you're conscious as it relates to the people and the environment you are around,
Mhm.
that it all works together.
You know, everything that you're saying aligns so beautifully with the project, with the NHOP project. I mean, my gosh, I just got that mixed up with the CDHNOP project. Um, in that, it sounds to me like you made just like really simple tweaks to your nutrition, and you kind of leaned into what's natural for you already, running and mindfulness. And that's really what the project is all about. That's what we're trying to encourage the Caribbean diaspora to do more of.
Yeah, and it really starts with a mindset, education, and having the availability of resources. You know, I don't accept the fact that some folks say, I can't eat healthy because it's too expensive. There may be some level of truth to that, but if you really think about it, when you can go out and go to Cheesecake Factory and spend $70, $50 to eat a meal, how much spinach can you buy for that, right? How much
Mm-hmm.
squash or zucchini you can buy? How much
Yeah.
scotch bonnet pepper or thyme or kalaloo, right? That you can prepare a meal that could last you, that you could get at least 3 servings out the week for that. Dinner tonight,
Mm-hmm.
lunch tomorrow, and maybe leftovers another day, right? For the same price. So it's really in our choices. Or that $5 cup of coffee that you buy every day. Those dollars add up. So it's really about priorities and knowing that I think once we educate folks on what certain foods do to the body and do to your body, knowing your family history, if you know that your parents had high blood pressure or diabetes, that perhaps you might be predisposed to that. So you may need to take certain precautions and just adjust your lifestyle accordingly so that you can prevent yourself, because morbidity is a real big issue. As we can see, it's expressed in people of color, and when we are not exercising, when we are not combining it with diet, it's a challenge. And coming from my pharmaceutical days, even
Yep.
though I would speak to some of the most brilliant scientists, the most brilliant doctors, no matter what pharmaceutical treatment that they will um, prescribe for your morbid condition, what's in that product circular? The first thing may be an adjunct to diet. Take one dose or twice a day, but everything is predicated on you eating well, and it's so important.
It's critical. Do you have any other words of wisdom? I mean, you just really dropped the mic on that one, Mayor Messam. Do you have any other words of wisdom that you could share with our audience today around health and nutrition?
Well, health is wealth. I think that, you feel well based on how you have to work at it. You just don't wake up. I wish I could say I wake up and look fit. I have to work at it because I'm big boned. If I didn't do anything, I would be 260 pounds easily and probably don't look it, because I have a large structure. I'm 6'5", 225 pounds. But if I didn't run, if I didn't watch what I eat, then perhaps maybe I would be, in a position where I'm overweight, hypertensive, um, putting myself at risk of, getting diabetes. And these are all situations. And COVID-19 really expressed on how, our community was impacted, because not only did it impact us in a way so drastically, but if people of color that contracted COVID-19 and they had a prior existing condition, it just exacerbated those ailments, and unfortunately we've lost so many loved ones, we've lost so many friends, and all of this can be prevented. So you really have to, like I said before, care about your vessel to the point where you are committed to ensuring that you are going to do the best to feed yourself. So that would be my parting words, is that no one is more important than you, and it's up to you to take care of you. So love yourself to the point where you are going to ensure that your body is in the best position so that you can feel well, you can operate well, you can love your family, you can love your job, you can love your business, you can love everything about yourself, and you have the energy to do so. And doing that is having a healthy lifestyle.
I love it. I love it. Thank you for those words of wisdom. I'm going to ask the audience if you have any questions now, please go ahead and type them in the chat or type them in the comment section on Facebook. so that we can get your questions answered. And while we do that, I'm going to go ahead and bring in Dr. Hafizullah, who will also join the conversation and share the tips for the day. Dr. Hafizullah, those are some real gems, right?
Absolutely, Mayor Messam, your words of wisdom were inspiring and powerful, and I think you captured the soul of our Caribbean Diaspora Health and Nutrition Outreach Project.
Fantastic. So do we have any questions? Go ahead and type them in the chat. In the meantime, Mayor Messam, I do have one other question, and I think it's fitting that Dr. Hafizullah will join us for the tail end of the conversation. The last time you and I spoke online kind of publicly was at the beginning of the pandemic. And at that time, we were all trying to figure out what to do and where to go. And in our conversation, you shared about some health policy moves that you were taking in the city of Miramar. How has it been for you guys 1 year later?
Well, Miramar, we were very aggressive in terms of using the available data that we have. We basically treated COVID-19 in the onset like a hurricane preparation, where we went into emergency preparation mode, where we ensured that first we wanted, because there was very little information that was coming from the CDC, but that the information at the time, we knew that we had to protect the community. We had to protect our most vulnerable. And because everything was sheltered in place and shut down, we knew that people needed to eat. So we had to get food prepared for those who needed food. And we worked with our community partners to do so. We helped our small businesses to help keep their lights on and their rents paid. But a year later, now we're in a really big push to get our community vaccinated. Despite all of the resources, setting up our own testing site, setting up our own vaccination site with the governor's office. And it was a chore for my office working with the governor's office to get those additional resources in Miramar. We're still not where we need to be in Miramar in terms of vaccinations. We range anywhere from, depending on the zip code, we have 3 zip codes in our city, actually 4 zip codes in our city. And the highest zip code is at 49%. The lowest is at 43%. And that's probably more so, as you said earlier, we have a predominantly Black and brown community. There are many factors that contribute to that. And it's not that because of resources, because in our working class community has the highest percentage. And in our Western communities where it's more, more middle class, more affluent business owners, they have the lowest percentage. So it's not an issue of resources or accesses to resources. So that means it's an education issue and it's a cultural issue. People have personal reasons on why they're not getting vaccinated. So our job is to ensure that we are providing the right information to get people in a space where they see that the risk is greater not to be vaccinated. And I don't know if there's a greater statistic than this one I'm about to share as a motivator. It's been stated that 99% of the people who are dying and are hospitalized by contracted COVID-19 right now are those who are unvaccinated. I know people now that have been vaccinated and have contracted COVID-19. None of them have had to go to the hospital. They've just expressed symptoms of the virus. None of them have been admitted. So that's a very striking statistic. So if you can continue to listen to conspiracy theory, false information, or unproven or not based off data and science, that statistic is an eye-opener. 99% who are dying and are hospitalized are unvaccinated. So at least it shows that if you're vaccinated, it prevents your risk of dying and it prevents your risk of having to be hospitalized.
Which is a huge value. So we have one question from Facebook. They're wanting to know, and perhaps Dr. H, this is more of a clinical question. They want to know, will there be new measures for the Delta strand, the Delta variant of COVID-19?
So I would just underscore what Mayor Messam said, vaccination, vaccination, vaccination now will help to stave off any significant complications of a reinfection or breakthrough infection. And of course, the social distancing and the other measures that we have in place to prevent you from being immersed in a situation where you're exposed now to COVID, and that may kind of push you towards a breakthrough infection if you are vaccinated. If you've not been vaccinated, as Mayor Messam absolutely is correct on that, make sure you do get vaccinated, because this can save your life and the lives of those around you. Because while you may feel healthy and well, you have vulnerable communities around you, those who are older, those who might be immunocompromised, children, others who may have other inflammatory and immunocompromising diseases that can cause them to have this lead to death.
Yes, for sure, for sure. Well, Dr. Hafizullah, I know that you have some health tips to share with the community. Do you want to go ahead and share those now?
Absolutely. And actually, I'd like to underscore what Mayor Messam said about living a healthy lifestyle. That is truly the foundation for health and wellness moving forward. And during the time of the pandemic, we know that mental health has certainly really risen exponentially to crisis levels, right? And I'll tell you, the connection between food and exercise and your mental health is also something that should be emphasized. So just simple things like cutting back on sugar, even getting rid of the table sugar. Don't replace your sodas with water. Read some of the food labels and look for the carbohydrate content. And the lower you can go, the better off you are. If you can completely replace sugar, that's going to have tremendous benefit for you. Your gut or your intestine really sends signals to the rest of your body. Whatever you put in, and sugar is one of those foods that really potentiates inflammation and causes your immune system to take a downward spiral in many cases. At a time now where we want to have the very best health and to stave off depression and anxiety and suicidality that we're seeing rising numbers in, just remember, eating healthy and well, lowering the sugar, lowering the salt, taking a chance to exercise a little bit more. It could be parking in the furthest parking spot before you walk into a building. It could just be you walking with your family in the afternoon to decompress and talk about the day, or joining Mayor Messam's running club. One of the other ways that we spoke about in the Caribbean Diaspora Health and Nutrition Outreach Project is we recognize that most of our Caribbean communities prefer walking and being together and having that camaraderie, reaching out to family and friends. So continuing those pieces, and then small changes like eliminating sugar, as I mentioned, can really help you to have tremendous benefits in your health and wellness in the long term and stave off those complications in the long run.
Fantastic. Thank you for sharing that, Dr. H. Now, I know we have a Jump Up Fitness Challenge that's coming up in, I believe we kick it off September 12th, right?
September 11th, I believe. Yes.
September 11th. Yes, yes, yes. And so, Mayor Messam, a lot of what you did with the screenings and getting people out and moving, that's just so aligns with the project. So we're going to be sending you some information. Maybe the City of Miramar can join us as we get fit together.
Yes, anytime. Looks great.
All right, fantastic. We're going to help people get carnival ready. All right, you guys, thank you so much for joining us for this wellness webinar. We will be back in a month. In the meantime, remember, tune in so that you can watch the healthy cooking segments that Dr. H does every month. Cook in the Kitchen with Dr. H. So I look forward to seeing you again. And remember, be kind and loving to yourself. You deserve it.